Hello and welcome. The question that what is the best time to do hospitation, or should I come to do hospitation during my medical studies, or should I come to do hospitation before having completed my B2 level? Now answer is that you can. You can do hospitation at any point of time. For example, someone who is already a practicing doctor, dentist, wants to know about German system, how things are done, how the protocol is, want to experience those things firsthand, just watch it. I mean, obviously it's a hospitation, observership, you will not be allowed to do anything, but you can still watch it, you see and learn for yourself. So that is, for that, language is also not required. That means B2 level is not required. You can do that at any point of time if the hospital accepts you. But should you do it, or how does it help? Now that is a question. For someone who does not want to apply to Germany for long term, or is in now in medical studies, for example, second year, third year, and there is time that okay, after 2 years, 3 years, you will apply to Germany and you will work, you intend to work as a doctor in Germany. That also can be done. That okay, in that short duration, even in the beginning phases, you'll get first hand idea that how things work and is it worth it? Do you want to work there in the future? So get that experience, to get that insight. It's a good thing to do a hospitation. But for someone who is at end of their medical training, medical college, and want to pursue post graduation or further residency in Germany, for that person, when does it make sense? During internship, I would say no, because for that your internship duration will get extended, and you cannot do anything without your completion of a medical training. Okay, that means you have to complete your medical training as soon as possible. Medical training includes your course, your internship, and getting a registration, a license. Someone who has just completed internship, does not have license, or just completed a medical course and does not have not done internship and don't have medical license, so those are not completed doctors. You are not a doctor. And again, through this video, again I would like to emphasize, you have to be a doctor to apply to Germany. Now this is controversial, that okay, which one country license, two country license, and all those things. For that we have different videos, but today we are talking about hospitation, and you have to have that thing to apply to Germany. So for candidates who want to pursue the post graduation or further career in Germany, for them it is important that to complete it, you have to be a doctor, completed doctor, before you come to Germany for hospitation. Now, considering the language, what level of language you should have? Is B2 must? It's not a must. As I said, hospitation can be done at any level. But is it helpful to have B2? Certainly, because that will help you in better communication with people, with your patient. I mean, you will not be able to have direct communication with patient, but in general, you will understand what is going on, what are they talking, what are people, what are the colleagues, what are your colleagues talking among themselves, the overarts, the consultants, the senior people, when they talk to you, you will understand what are they saying to you. So that's why B2 is important to have. Secondly, what is the importance is that if you don't have B2 and you want to work in Germany, you know in back of your head that you must have B2 certificate, and before that, or otherwise, you will not be allowed to work as a doctor in Germany. You will not get the medical license here. That means that burden of learning the language is always there on your head, and that affects your performance or your work or your time. I mean, you have less time to study for the language when you're doing hospitation. So that is, your focus gets deviated. That's one more reason why you should have completed language beforehand. The next thing is that when you come to Germany, your aim has to be to find work, to find job as a doctor. Okay, so before license you cannot get a job, but the process of finding, the search, you can begin right at the beginning itself. So that, because it takes few months time, and when the time comes, by that time you have completed the license and everything, and then it matches actually, that the interviewer likes you as a person, as a doctor, and then they say that okay, how long is your application process been, when can you begin? And that time, if your application is already in the process, you have already appointment for the Fachsprachprüfung exam, for example, then you can say that okay, this month I'm going to have my Fachsprachprüfung, and then probably, hopefully, I'll pass the exam, and then I can work as a doctor. So this gives them a solid, concrete something to work upon, to think about your application. If you apply with a CV that okay, I'm doing B1, or you are doing like A2, then they are less interested in you because they know that, okay, till B2 and it will take time. Okay, so it will take time, so that means it will not happen fast. So that is one more con why one should complete the language before coming for hospitation. Okay, because if you don't do that, there are high chances that you might have to go back after your hospitation because your visa will not be extended. So you will have to go back after your hospitation and complete the rest of the process and then come apply again for recognition of professional qualification for the Fachsprachprüfung course and everything, and then come back to Germany again. So that's why I say best route is that we recommend to our consulting candidates as well, is that you make a plan and come in a one phase where you come for hospitation, do Fachsprachprüfung, search jobs during the process, and after Fachsprachprüfung start working as a resident. That is the most time effective and cost effective way, rather than coming for hospitation without having the appropriate requirements that are required for the license. So yeah, that is what I wanted to say. That there's no wrong time to do hospitation. Only thing is that some ways are more productive, more cost effective. Some are less cost effective. That you can be a second year student who just want to see how German system works, and you can have a 2 weeks hospitation in some hospital. That's all fine and good, but that will add to your CV definitely. That okay, this person has some idea about Germany. That will you will have stamped to Germany stamped on your visa, like a visa stamp on your passport. That means it will help you in next visa as well. So all those are fine, but is that the best way to do it? I don't think so. All right, this was about the timing of hospitation. Do write your comments. What do you think about the video? If you have doubts and questions, write in the comment section. Thank you. Bye bye.